Saline is a mixture of sodium chloride and water with a concentration of 9 grams of salt per liter, commonly called saline, and has long been used in clinical practice to replace fluids and electrolytes in hospitalized patients with low blood volume and low blood pressure. However, recently there is increasing evidence that it increases the risk of metabolic acidosis, acute kidney injury, and death, most likely because it has a higher chloride level and is slightly more acidic than human body fluids. For this reason, scientists suggested using Ringer's lactate solution instead of normal saline. Lactate Ringer solution contains electrolytes more similar to blood plasma than saline and is a type of balanced crystalloid that is much closer to the pH of human fluid and has no risk of kidney damage. Given this data, hospitals should consider whether they should continue to use intravenous saline or replace it with lactate Ringer solution. Who is armed is protected. Take care of yourself and be healthy.